Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, there's a new Colorado law that very well could endanger patients. I'm going to tell you all about it. And then we got a special guest talking about Gen Z fashion. And then finally, when do you need to worry about lumps and bumps on your skin and soft tissue? I'm going to tell you. And it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer, Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me today is not Sarah.
Hi.
It's my daughter, Danica. Sarah is at a work function and couldn't join us, so Danica will be filling in and doing a special segment today. I'm very happy about that.
Yes, I'm so glad to be here.
Oh, thanks. This is actually your second time to be a guest host. You did one, it was a year or two ago?
I think so, yeah.
That was a lot of fun. It went really well. You're very good at this.
Thank you.
In the box, we got Travis. How are you, Trey?
I'm good. How about you?
I'm doing great. How you been? Did you miss us last week?
I did.
Yeah,
I did.
we were gone on spring break.
Yeah.
Last week's was recorded.
But it's okay. And
Yeah.
we're back this week, so we got
Yeah.
some good information, I'm sure.
Have you been on any blind dates lately? I remember last time we talked that you were like...
No.
No?
I haven't been on any blind dates.
No?
Not,
Okay.
Not lately.
I applaud you. You know, Trey goes on blind dates every now and then.
Really?
Yeah.
That's cool.
He's very adventurous. I
That's
always
funny.
like to hear about it. I'm living vicariously through him because my dating days are like long gone.
Yeah. I'm not opposed to it. I'm not opposed to it.
All right, well, let's jump into some segments. We're going to jump right into it. So this first segment, I'm going to have to thank Dr. Travis Morrell. He's a doctor out in Colorado. He actually reached out to me to get my opinion on a new Colorado law that very well could endanger patients. And so the bill in question is Colorado bill. It's actually not a law yet. It's still a bill. It was going to a special committee this past week. It's Colorado Bill SB 25-129. And I'm going to kind of summarize it for you because, of course, politicians make laws and they're, sometimes hard to follow. But this law shields doctors from out-of-state malpractice lawsuits and also prohibits hospitals and facilities from participating in subpoenas. So what that means is if like a patient's going to sue a doctor or facility, they subpoena medical records. So that it basically prohibits the hospital from giving these patients those medical records. And these are specific only to abortion services and gender transition medicine. So, being neutral politically and being a centrist, I'm reasonably pro-choice as well as being for transgender rights within reason. I know I've talked about that I'm not really big into like gender surgery for kids or hormone therapy for kids for all the reasons we've talked about in the past. But even though I'm for these issues that this law is trying to protect, I do think that this bill is very, very bad. And I'm going to explain why. And I do think this is kind of a classic case of government seeing a problem and they're trying to help, and then they make a law and it actually makes things worse because politicians don't always understand the workings of different things out of politics and the law.
Yeah.
So one of my side gigs is, I don't even know if you know this, Danica. I think I've mentioned it, Trey. I do actually malpractice consulting. So what that means is if a patient has a really bad outcome, usually specific to plastic surgery, if I meet up with them, I can help them find a lawyer that might take their case, and I can offer expert testimony to say that, okay, malpractice did occur. I usually do plaintiff malpractice, which means I help patients who have had something really bad happen to them, and there was like negligence by a facility or a doctor, and when that happens, people's lives can be ruined. You can die or be disabled, and so there's a process to get reimbursed for that when that happens, and that's malpractice lawsuits. And although malpractice lawsuits are not common, I mean, I think that in general our doctors do excellent jobs. I think, of all specialties or professions out there, doctors do a great job, but not all the time. I mean, no profession is 100% perfect. And so, when these bad things happen, as I said, it could be death, it could be, a permanent disability, and you may not be able to work, and suddenly, your whole life could be ruined. And so the ability to, sue a hospital or sue a doctor is actually a good thing. I mean, it gets abused, and there are some states where I think the laws are too loose and doctors get sued way too often, but there's definitely a balance. So knowing what I know about this, I think that this law has some serious problems, because if you're shielding doctors from being sued, then you're basically taking away patients' rights and patients' peace of mind. Because I think every patient has a right to have good care, and if that good care is not given and there is negligence happen, then the facility, the doctor, needs to be held responsible. And because these things can be life-altering, there has to be money involved. And so shielding doctors, and this goes for anything, not just abortion services or transgender medical care, which I'm actually for those things. This goes for any part of medicine. I mean, if someone was going to make a law that said, if you go and have plastic surgery and something bad happens, you can't sue your plastic surgeon, even though that would potentially be beneficial to my specialty, I would be against that, because it's just not right.
Why do you think that they did it specifically for abortion and just transgender?
That's an excellent question, Danica. So, I mean, as you may or may not know, you're pretty savvy, so I assume that you know these things. But abortion services and transgender healthcare are certainly controversial topics today.
Yeah.
There's some people that are very for them. There's some people that are very against them for various reasons. Unfortunately, it's become political, where it's one political party tends to be on one side and one on the other. Now, as I said in the beginning, I'm actually politically neutral. I don't claim any political party because I think both parties have problems. But in general, I'm in favor of these things within reason. And I think that is something that should be noted, that when you talk about these topics that are controversial, it doesn't have to be black or white. I mean, things can be gray, which means you can be for something, but not for extremes of it. You know, and I think that when you look at the average American, that's how they are. I mean, these topics that are so politically charged, like the media and politicians want to make you think that everybody's either 100% this or 100% that. Well, there's a big part in the middle where it's yeah, I think that this is a very reasonable thing, but there has to be limits to it.
I agree.
And so that's how I personally am. And so anyway, to answer your question, Danica, these topics have become political, and I think that some people that are against these things, like abortion services and transgender health care, are trying to attack them. And they're trying to attack them with lawsuits to stop them, which I think is also wrong. And this is why I go back to, politicians trying to help and making things worse. This is a case of people trying to help and making things worse, because what they're really doing is they're taking away the rights of patients to, have the peace of mind that if something goes wrong, that they can be made whole again through a malpractice suit. And so that's why I'm actually really against this law. It's almost like when people go out. Have you ever heard of medical tourism?
Yes, I have, where people go to another country to get a service.
Yeah, very good. Yeah, absolutely right. Did you hear me talk about that, or did you see it on social media?
I think both.
Both, okay, yeah. So that's one of the big problems I have with medical tourism is, say I go to, pick a random country in the Caribbean, Dominica, and I get a nose job, and my nose falls off. I mean, it's almost impossible to sue the person and say that the person came in drunk and that's why my nose fell off. There's no way that I can potentially get remunerated or reimbursed for having to have tons of more surgery to reconstruct my nose.
Yeah.
So that's why I'm against this law. I think that the bad thing that could happen with this is, as I said, I think most doctors are good. I think most doctors are really out there doing good work and being competent, but not always. There are bad doctors. I mean, it's impossible to believe that there's a specialty or a profession that doesn't have bad actors. And when you have a law like this that shields them from being sued, it's going to attract bad actors. And so I think that the other thing outside of patients not being able to rightfully make lawsuits if malpractice occurs, the other thing is it could attract doctors that have had a history of malpractice, like meaning that they've done bad things in the past.
Yeah, that's like really horrible.
I mean, it could be. I mean, I'm like looking at this kind of in a deeper, and this is where I, as somebody who both is a healthcare professional and also is involved in representing patients who've had malpractice happen to them, it's where I can kind of give an insight to this that a politician might miss. They're just like, oh, this law is going to, make sure that patients can get these services. Well, yeah, it'll help, but it's also going to do something really bad. And so, at the end of the day, I think that this is going to strip patients of their rights. And so I think the intention is good, but I think the law is pretty bad.
Yeah, I can agree. You did a really good job explaining that, though.
Oh, thanks. Did I explain it in a way that you can understand it?
Yeah, because
you're pretty smart. So
I've never heard about this, and so you'd explain it in a way where both sides could be shared. So that was good too.
Yeah, I always try to look at things very neutrally, and because I'm not really politically right or left, everything I look at is from a very neutral, common sense perspective. And so anyway, that's my common sense perspective on this. It apparently is going to pass. So I actually testified in the oh man, I don't want to say the wrong word. It's like the special committee that was discussing the bill. I actually testified. Dr. Morrill, Travis Morrill asked me to testify because I knew stuff about these topics, and so I did. And I did say, hey, I'm actually for these rights, but this law is bad. And as expected, the law, they don't, politicians don't care. They vote along party lines, and that's what happened. The one side voted yes, and the other side voted no, and no one really paid attention to anything I said, which is, unfortunately a sad state of our political system right now. And it looks like it's going to go back into their house and probably will become a law. So we'll see what happens. I mean, maybe I'm wrong. Maybe nothing bad will happen, and I'm being overly worrisome about this, but I don't know. I don't think I'm wrong.
Yeah.
So. All right, let me recap this one real quick, Trey. So today we were talking about a new bill which is very likely to become law in Colorado, Bill SB 25-129. I was asked to speak about this bill by Dr. Travis Morrill. It basically shields doctors from malpractice suits and also shields hospitals from having to answer to subpoenas for medical records from out-of-state patients that are trying to sue for care regarding abortion services and transgender health care. And so, as I stated when I was talking about this on the show, I'm actually for these things within reason. As always, I'm kind of neutral and a centrist. But I'm against the bill, and let me tell you why. When you prohibit doctors from being sued, you are taking away patients' rights. A patient should have the right to the peace of mind that if malpractice or negligence occurs and something terrible happens, like a death or a lifetime disability, that they can sue the facility or the person that's responsible to get reimbursed for the surgeries they might need or whatever else expenses are going to occur because of that negligence. And this law is going to prohibit that. And I think that that's a very bad thing, even though I think the intention of trying to preserve these services is overall good. Also, it does have the potential to attract physicians who've had a history of problems with malpractice suits because it's a shield. And so I think it potentially could bring, less desirable doctors into Colorado. So yeah, I'm a little worried about this bill. I think it will become law based on what I've been told by Dr. Morrill. And so we'll have to see. Maybe I'm wrong and I'm being overly cautious, but I have been in healthcare a long time. I also do represent patients who've had malpractice against them in lawsuits. And so I have a pretty good knowledge base of this, and I'm kind of nervous about this one, but we'll see. So, very good. Okay, Danica, last time you were on the show, you didn't get to do a segment.
Yep, and now I get to.
Danica's going to do her first segment. And so we were talking about when Sarah said she couldn't come on, I was asking Danica to come on. I was like, you should do a segment. And so Danica has a very good knowledge base, but one of the things that she actually very much impresses me is Danica is very good with clothes and fashion. And so Danica is going to do some young Gen Z fashion. And before you start, because I know you put together some outfits and you're going to tell us about them.
Yeah.
Right? So I'm going to ask you some questions, even though it's your segment. Is that okay?
Yeah, of course.
Okay. So you're 14 years old. You're young Gen Z. You are Gen Z, but you're kind of at the younger edge of Gen Z. Would you say it is fair to say that you are interested in clothes and fashion?
Yes.
Like very much so, or like?
I would think very much so. Like every time I go out, I like to be like, okay, how could I make this outfit with stuff I already have at home? And I just really think about it a lot.
That's very cool. Actually, when I was growing up, I was the same way. So you're chip off the old block. And what is it that you like about like fashion or putting clothes together?
I like that you're able to, like, no matter who you are or what type of things you like, you're able to express yourself through fashion. Like, let's say you might like, more dark stuff, or you like really like poppy stuff. Both people can express themselves through fashion, and you can explore different things. Right.
So in the sea of everyone being the same, you can make yourself an individual through the clothes you wear.
Yeah.
I think that's very awesome. So let me ask this: where did you and where do you learn about like fashion and clothes and like what looks good together?
Mostly what I do is I'll go on Pinterest to get some inspiration.
Really? And Pinterest? You know what's funny is, and I'm sorry to interrupt you, Pinterest is one of the most ancient like website apps in the world. Pinterest has been around forever. And I just think it's cool and kind of funny that you're into Pinterest. But go ahead, sorry.
I'll look up like this type of fashion I'm into, like Y2K or like kind of grungy, and I'll be like, okay, that's similar to what I have. So maybe if I use what I have based on this picture, I can kind of put it together similarly. Interesting.
And would you say that you get some of your kind of fashion knowledge just from like social media or like regular TV or magazines or what?
I would say a lot of social media, and sometimes I like to look at like influencers. They're like they're not like influencing me what to wear, but they'll kind of like help you with knowledge. They'll be like, oh, if you want to wear something baggy, you should wear these types of jeans or whatever, just so it kind of gives you a outsider view.
Okay. Very good. And you told me before, and correct me if I'm wrong, that you actually use apps or programs to try see what outfits go together before you actually put the clothes together.
Yeah.
So do you have some that are your favorite, or?
So I like to use this app called Just to Impress, which is just a fashion game you can play.
Okay.
And one time I really wanted to go to the mall, but I wanted to make sure my outfit was good because I've been planning this for a long time.
This is a special trip to the mall.
Yeah.
Okay,
so
right.
I was like, okay.
I remember those days of special trips to the mall. It hasn't been that long.
I was like,
Trey, special trips to the mall where you got dressed up. Is that something you did?
Yes.
Yeah.
I actually had a date at the mall one time.
A date at the mall? Was it a blind date?
No. It wasn't a blind date.
It
wasn't a blind date. I think I probably had just graduated high school. And we just walked around the mall.
Dude, that was a thing, man. Listen.
Yes.
I mean, I know that you're younger than me, but like back in my day, that was a common date. Like go to the mall, walk around, go to the arcade, the Orange
court.
Julius, like get the movie theater. All right, sorry, Danica, we didn't mean to.
It's okay.
Flashback.
Dude, I love Orange Julius. That place still exists too. You can still find those things,
Really?
man. Yeah, it sure does.
That's
Have you
funny.
had Orange Julius? We're gonna have an Orange Julius. Maybe not today, but you have to have one.
Okay, I'm ready.
Okay, so sorry, you were telling me about this trip to the mall, and you were trying to.
I needed the perfect outfit.
Okay.
And my outfits have a lot of accessories, so I didn't want to put on a bunch of stuff and be like, oh, I want to do this differently.
Okay.
So I was like, I'm going to recreate the outfit based off stuff I have in Dress to Impress first.
Really?
So I decided to do that, and I was like, okay, I like how this top looks, like covering up part of the shirt or whatever.
Okay.
And so then after I made the outfit, I was like, okay, I'm ready to put it on. Like, this is my final fit, and I did it, and it looked great.
Wow, that's really cool. That's something I have never done, is use technology to prepare my outfit before I actually put it on. And I think it's kind of cool. It's like a new kind of way to look at this. And so, all right, my last question before you show us these outfits that you put together. So where are your favorite places to get clothes? And I will say, because some people might think, oh, well, her dad's a doctor, they're going to shop at the Galleria or all these high-end places, which is not true at all. So where do you like to get your clothes? Do you have special places you like to get or ways to
Yeah.
get clothes?
I really like to go thrifting and to overstock stores with my friends. There's a bunch of cute clothes there. I love going on like big shopping trips because I can get a lot of clothes for cheaper than I would if I went to the actual store.
Right.
And two of my favorite stores that I like to go to that are just regular stores is Edge and Windsor.
Okay. Very good. That's great. I know that you've done some thrifting. I think that's very cool. So, all right. So, you put together some outfits,
Thank you.
and these I've seen you wear a million outfits, and I was like, wow, that really looks good, and which is why I told you should probably do this. But you put together 6 outfits for us that you like, right?
Yes.
Okay. And the first one is the outfit you're wearing. Okay. And so we don't have pictures because we just have you. All right, Trey, can you go over to that other camera? Yeah, there you go. Keep dropping your cards here, girlie. So tell us about what that is.
So this is a 1950s vintage dress that I got in the Denton Square, and it's a size small. It's very cute, and it is 2-piece. The first piece is just a regular strapped dress, and then the next piece is a coat, which is pretty.
I do have to say that like vintage clothes oftentimes have amazing craftsmanship. Like I mean, you probably can't tell on the video, but like just the work on this is actually very, very beautiful. It's honestly like an art piece. So you can go ahead and have a seat, kiddo. So do you like vintage clothes? Is that something that you're into, or this just happens to be a one-off that you saw this dress and you liked it, or what's your deal with that?
I really like vintage clothes. I like to get clothes from like eras and like decades that I was never able to see myself, and just kind of live it in the 2000s.
I think that's awesome. It's very impressive. I like vintage clothes, and I don't know if you got that from me or just happens to be that you also like vintage clothes. But I think that's pretty awesome. So okay, now we're gonna go into the other outfits that you put together, and you're gonna tell us about these, right?
Yes.
Okay, Trey. Yeah, thanks, Trey. All right, so this is the first one here. So what can you tell us about this outfit?
So it's an asymmetrical one-sleeve top, and it has some dark wash skinny jeans that I got from my mom, and she got them from
Hand-me-downs,
Paris.
huh?
Yeah.
They're hand-me-down jeans. Well, they look good.
And there's Doc Martens.
Can mom still wear those jeans?
I don't know.
She probably could. You guys are about the same size.
I think so. Doc Martens that I got for Christmas at Journeys. I have some chains and necklaces for my mom, and that wing necklace is from Harley Davidson.
Oh, cool.
And I have actually, it's kind of funny, I have my swimsuit cover up as like a little sash
Yeah,
on
I
the
see.
side.
It's like a sash there.
I just like to add some extra flair to my outfits, and honestly what I'll do sometimes is I'll just go around my room and be like, oh, this keychain's cute, I'm gonna put it on my my belt loop, and that's just how I do it.
Yeah, you do like accessories. I mean, not always, but for some outfits, I do see that you like a lot of accessories. And so, what do we got here? What's this next one?
This is like heavily inspired by Avril Lavigne because I love her and she's just an icon. And
Okay.
so first, the top is a sinful transparent top that I got from Buckle, and underneath, which you can't really see well, it's a black crop top that I got from Windsor.
Okay.
And the jacket is a Guess jacket that I got from Macy's, which I was very happy to snag.
Did you get that on sale or something?
I got it on a really big sale.
Oh, did you?
And
Okay,
so
good.
I was really happy about that. And the shoes are Karl Lagerfeld shoes that I also got from Macy's, same place.
On sale, I hope. Okay.
A sale.
How much is this outfit costing me?
And the shorts I got at Goodwill from my friends.
At Goodwill. So from Macy's to Goodwill in the same outfit, but it all goes together very nicely. I think it's super cute.
Can I say this? Can I say
Yeah.
I'm super impressed too by the Gen Zer knowing who Avril Lavigne is.
Oh, dude, Trey, she knows about. Well, who's your favorite band right now?
Radiohead.
Radiohead. That's
Yep.
dope. I like it. We are in good hands.
Yeah, I know. All right, what do we got next? Oh, I like this one.
This is kind of just a biker outfit, I would say. I got the dark jeans I got from Mom, my favorite boots, which I'm always wearing.
Yeah, it's like combat, like motorcycle boots almost.
Yeah, and a Ducati top because my dad's been very interested in Ducatis lately. So he got me that, and I just love to wear
You look
it.
like a biker chick in that.
I am a biker chick.
You are a bike. You are a bike. You don't have your own bike, but you've put more miles on the back of a motorcycle than most people. So yeah, that looks
Yeah.
great. It's fantastic.
Just simple.
Yeah, it's kind of simple and not over the top. Yeah, I like that. All right, what do you got here?
This is my like more fancy going out outfit. It's a fur hat that I got from an Overstock.
It's not real fur though, right?
I hope not. I got it from
No.
an Overstock store,
Yeah,
so
I'm sure
I
it's
wouldn't
fake.
know.
Dr. Herman price checking.
Gosh, that must be fake.
I got.
It's super cute. It
I
looks
got
like
it at
one of
a
those
mall.
Russian fedora hats.
Yes, it's super cute. I love adding it to my outfits. It's just the perfect piece. And the dress I got in a small little store on the Highland Village
All
shopping
right, I
center.
was with you when you got that, and it's got
Yeah.
fur. It's got that fake fur on it as well.
And what's funny about that dress is whenever we went to get it, the store was closed, but the doors were still open, so we just walked right on in.
I remember that.
And they
yeah.
were like, just buy it. I mean, we'll take it.
I think it looks super great. I think that the hat and the dress just go together perfectly. Like, I love it. It looks great.
Thank you.
Okay, what do we got here?
This is heavily inspired by Y2K fashion because
Oh, definitely, I can see it.
that is one of my favorite like fashion genres.
Y2K, huh? Mm-hmm. And so, yeah, okay, excellent. I love
And
Y2K.
so that is a top I got from Ross.
And that's a sweat. Is that it?
It's
Crop
a
sweater?
turtleneck.
Okay, crop sweater, but it's crop. You don't see those very often.
Yeah.
That was kind of like a late 90s thing, I think.
I was really happy to find it. I was just going through Ross and I saw that. I was like, oh my gosh, I need to get it. And it was cheap too, because like usually on Depop that would be like $30. So I was like, wow, got it for a good deal.
How much did you get it for?
Like $7.
$7? Dang, you are a good shopper.
And the shoes are some vintage Doc Martens that
Oh, those are vintage dogs.
I
Did
have.
you dig those out of mom's closet?
She gave me them. And then I have my favorite bell-bottom jeans I got from Buckle and my nice Target belt.
That is epic. I love it. It's definitely, I mean, I can totally see that being like a late 90s, early 2000 outfit, like 100%.
Yeah, thank you.
That's awesome. All right. That was really good, Danica.
That was a great segment.
Yeah, very,
Great
very
segment.
impressed. And I know
Thank
you have like,
you.
probably have 100 more outfits. She has all these outfits she's put together. She'll like come down and be like, how's this outfit look? I'm like, you look like you could be like in a magazine,
I
honestly.
think the best part about it, Danica, is that you passed the price check as well from
I
Dr.
know. I
Herman.
was like,
Thank you.
you got that from Macy's?
Yeah, right.
Who took you to Macy's?
You knocked
Mom.
every price
Mom
question
took you
out
to
of the park.
Macy's?
Yeah.
Mom's like spends less money than I do. I'm shocked she let you go into Macy's.
That's funny. That's so funny.
Well, thank you very much. That actually was great. You did a great job on your segment, and give you a high five. Yeah, perfect. Excellent. Okay. All right. So I'm going to move on to my last segment, and this one is one that I get questions about all the time, and is it do you need to worry about masses on your skin or soft tissue? So I get few consults a month for skin lesions or what I call lumps and bumps, which are masses underneath the skin. And patients are always asking me, do I need to worry about this? Is this a problem? And I actually got the idea for this segment from an article in People Magazine. Throw that article up, Trey, as I always do. I post the article so you can read them if you want. I'll summarize it for you right now, though. Actress Janine Avanti, who's I actually haven't heard of, but there's a lot of actresses out there I haven't heard of. She's 51 years old. She felt a mass in her neck, and she went to, I guess, one of her primary care doctors, and they were like, well, you've had some lumps and bumps before, like, don't worry about this. And so she didn't really think about it too much. But then she went and got a consult for plastic surgery to get a facelift and neck lift, and the plastic surgeon felt this bump, and they're like, whoa, this doesn't seem right. So the plastic surgeon ended up taking it out herself, I believe, and it ended up being a pretty rare form of cancer.
Wow.
And so, yeah, that was kind of a close call. That's why this thing was in the news, is because, you know, she initially was told, oh, don't worry about this. And the plastic surgeon's like, no, you need to, like, we need to take this out. And then it ended up being cancer. And apparently she's going to be okay. And so that's kind of inspired me to talk about this topic about skin lesions and lumps and bumps, and, you know, do you need to do anything about them? Well, the majority of things on the skin and little lumps and bumps underneath the skin are benign. Do you know what I mean by benign?
No, I don't know
Okay,
what that
so
is.
when you're talking about cancers, There's, cancer, or also called malignant, and then benign is not cancer. So if you have a bump that's benign, it means it's not a cancer bump.
That's good.
Does that make sense? Okay.
Yeah.
Okay. So benign. I want to make sure you knew that, Trey, right? Just from being on the show.
I did know
Okay.
that.
Cool. All right.
I did know that.
All right. So I think if we're going to talk about these things, we do need to separate them into skin and then soft tissue because they're a little bit different. So when it comes to skin, if you're a young person like Danica or Trey too, I'd say you fall into that young category. Skin lesions are almost, not always, but almost always benign, meaning they're not cancers. When you get into middle age like myself or older people like my parents, the rate of bumps or things on the skin being a cancer goes up dramatically because, as you may or may not know, the older you get, the more sun damage you take, the more likely you are to get skin cancers. Which did you know that skin cancers are the most common cancer in the United States?
I didn't. I thought it would be breast cancer, honestly.
It is not. There's much. Breast cancer is number one cancer in women,
Yeah.
but skin cancer is number one overall. And a lot of times, when they talk about cancers and rankings, they leave skin cancer out because outside of melanoma, most skin cancers are not super dangerous. I mean, they can be dangerous, but so a lot of times, people will say, well, skin cancer is number one, but outside of skin cancer, like breast cancer is number one in women.
Yeah.
So the types of skin cancers that you see most commonly, and there are other ones out there, but the three most common ones are basal cell, squamous cell, and melanoma. I got a picture, Trey, throw it up if you would. And I will say that skin cancers can look all kinds of different. These are kind of classic looking, basal cell carcinoma on the left, squamous cell in the middle, and melanoma on the right, but they don't always look like that. Basal cells and squamous cells can almost look like anything. In fact, it actually can be really hard to try to determine what something is by looking at it because there's so many variations of what it can look like. Melanoma does typically look bad like that. It's the kind of dark, splotchy, just really kind of, scary looking, I don't want to say moles because they're not really moles, but like dark pigmented lesions. So when it comes to skin lesions, the most common complaint you'll hear is, I got something that's changing on my skin, or it won't heal, or it bleeds, or it's very dark or erratic looking. And if that's the case, then they need to be taken off. I have this mole on my cheek right here it's been the same for 50 years practically. I don't need to take that off. It's not changing. Doesn't look different. It's not growing. So that'd be a skin lesion where you're like, oh, this skin lesion's okay. But if this was changing, it was getting bigger, it started to look different, then it needs to go. Because even though most skin cancers are not overly dangerous, melanoma being the one exception, which is extremely dangerous, they can cause problems as they get bigger. So, my take on skin stuff, if you have something that's either growing or you have something that's changing, go get it looked at, and my recommendation is to get it removed. Like the first doctor that the actress saw that said, oh, this thing is probably not anything to worry about, I would have taken it out. And that was not a skin lesion, that was a deeper lesion, which we're going to talk about now, which is soft tissue. So do you know what I mean by soft tissue, Danica?
Like underneath the skin, like a different
Bam,
layer?
that is absolutely right. That's exactly right. So it's not something on the skin like my mole, it's something underneath my skin where the skin looks normal, but there's like a bump there. Absolutely right, good job. So soft tissue means below the skin, the subcutaneous fat. So when you're talking about subcutaneous or soft tissue lesions, they are almost always lipomas. 70 to 80% of soft tissue lesions that people go to the doctor for are lipomas. A lipoma is just a benign, which means what, Danica?
Non-cancerous.
Non-cancerous, very good. Fatty tumor. I got a picture of one. Trey, if you want to throw that up there. Yep, that's a lipoma. It kind of looks like fat, but it's more structured. Like fat in general is not very structured. It's kind of pulpy and kind of just doesn't have a shape. Lipomas have a shape. They feel like a much firmer piece of fat. They're painless, they're soft, they're mobile, they tend to be very slow growing. And when do you see a soft tissue lesion and think that maybe it's not a lipoma? Well, if there's rapid growth, if they're firm or fixed, or if they're painful, they have a large size, deep location, if it causes skin changes. Now, even though that almost all soft tissue masses are lipomas, When I see them, I do recommend that patients take them out because if they are lipoma, which is far and away the most common, they generally continue to grow and lipomas can get enormous. I've taken out lipomas this big, like I'm not kidding. They're as big as like a volleyball that people have had for 30 years and they just didn't do anything about. And the problem is even though they're benign, the bigger they get, the harder they are to get out, and the more invasive the surgery is to remove them. And eventually they will get big enough that you will want to take them out, not because they're cancer, because they just kind of get in the way, or maybe you look like a hunchback from Notre Dame with this thing on your back or whatever. And so eventually you're going to want to get it out, so it's best to get them out when they're small. And then there's always a chance it's not a lipoma. I mean, I've been fooled a couple times in my career where I looked at something, I was like, I think this is lipoma, and I pulled it out and it was cancer. I think I've had that happen twice in 15 years, so it's not common, but it can happen. So yeah, that kind of summarizes, skin lesions and soft tissue lesions. My take is that if you have a skin lesion that you've had your whole life, it's not changing, you're probably safe to leave it. If it's a skin lesion that's changing, it needs to go. Soft tissue masses, I personally take them all out because eventually they're probably gonna have to come out, and they're better to come out when they're small. So yeah, I mean, and I actually do lots of these. People send me this stuff because they want the closures to be perfect. And so, they send them to a plastic surgeon. So.
Can I ask you this?
Yeah, absolutely.
Is there anything that you can do to stop those type of things from like popping up and happening? Like anything that you can do as far as like soft tissue and anything? Or?
Soft tissue, probably not. Yeah. Skin, yes. Okay. You can prevent skin cancer by using sunscreen, being in the shade. I think we've done a segment or two on skin cancer.
Absolutely.
So you absolutely can affect the rate at which you get skin cancer. But soft tissue masses, to my knowledge, and I'm pretty certain on this, there's nothing you can do. Yeah. It's just like, it's a group of cells, the fat cells, they get out of whack. Or even say if it's a cancer one, like liposarcoma or sarcoma or the soft tissue cancers, they're really pretty rare, but they can pop up. I mean, there's nothing. I think there may be a couple of risk factors for those things, but they're very obscure and it's not like something easy to do. It's like if you drink too much or smoke too much, you have a slight increased risk of getting soft tissue cancers,
Okay,
so,
that makes sense.
Yeah, that's a good question. I like that one. All right, let me recap that one real quick, Trey, and then we're going to wrap up his day. So today on Nip Talk, we did a segment about, do you need to worry about lesions on your skin or soft tissue masses underneath your skin? And it's a question I get pretty commonly because I get a lot of people sent to my office who have these lumps, what I call lumps and bumps or skin lesions, and they want to know, do I need to take these off? Well, I think you need to separate them into skin or soft tissue. Let's start with skin. If you have a skin lesion that you've had your entire life, like this mole on my face that has never changed in 40 years, then no, you're fine to leave that alone. However, if you have a skin lesion that is changing, meaning it's growing, it's getting darker, it's bleeding, it's making a wound that won't heal, then it does need to come off. You do need to take that off because skin cancers are the #1 cancer in the United States. So a skin lesion that's changing at all needs to go. Now, soft tissue masses, which are almost always lipomas, which are benign fatty tumors, meaning non-cancer, you technically don't have to rush in to take those out because they are benign. However, you can't always tell that they are the benign lipomas. They could be the more rare cancer types. And also the benign ones continue to grow. So eventually you are gonna need to take those out. And so I recommend you take them out when they're small. You got a lump and bump underneath the skin, just go in, get it taken out, be done with it. Also have the peace of mind that it's not a very rare cancer. So if you wanna learn more, check out that episode on Nip Talk.
Okay.
Cool, right? All right, I think that's all the time we have today. Thank you, Danica, for standing in. I loved your segment. It was really good.
Thank you.
Give me a high five. Trey, thanks to you as always. Please, if you have anything you want us to do a segment on, leave us a comment and we will do a segment on it on the next episode of Nip Talk. Bye.
Bye.